We try to make appointments for our patients pain-free. A lot of people say there is no such thing as a pain-free appointment. We're getting there rather quickly. I've gotten to the point where I have a lot of patients that almost fall asleep in the chair. Root canal, for example, where patients will fall asleep, and because it's a relatively quiet procedure, and we have to actually nudge them a little bit, wake them up to finish the procedures. To ensure pain-free procedures, we do a lot of continuing education, so we're learning the latest techniques in terms of local anesthesia, working with Novocaine. We have newer types of Novocaine now that are much more effective in terms of giving to the patient, so the patient really doesn't know that they're getting numb. And we have ways of reversing the numbness, so you don't have to be numb all day. So if you maintain an active lifestyle and you like talking, eating, chewing, we don't necessarily have to have you numb for a whole day or 6 hours. We can change that around. And once again, the procedures we use, I've refined to the point that I know what's going to work, and I know their results are going to be predictable, and I can pretty much tell as we're going along how to handle that patient based on conversations with the patients to ensure that they're going to be comfortable. One of the big things we do for new patients, I have a survey that we use for all new patients. We have them fill out. It's called Please Handle Me with Care. It's an interesting survey in that it is a checkoff form. Has maybe about 15 or 20 items on that. A new patient comes in, they're new to me, I'm new to them, and we really don't know what to expect. So we try to make it easier for the patient. By having them fill that out, they can tell me on that phone, on the form, they can check off that they don't like cotton in their mouth, they don't like the sharp, picky thing poking at their teeth, they don't like the noise of the drill. Doctor has to speak to them in technical terms. They don't like doctors wearing white coats. They have to be seated in the chair, but they have to get up to swallow every 3 minutes. It has a whole bunch of different things in there. We find it very effective because by simply checking that off, before I even walk in to meet a new patient the first time, I already will know pretty much how to approach them and guide them through the treatment such that they'll have a good experience.